Good morning, everyone. If you watch the news, you may notice there was a new disease grabbed most of people's cautions during the past 2 years, even right now. In the beginning, this disease was not notable, but life-threatening. It's fast spreading, yet hard to be controlled. It combines so many scientists and medical professions from different countries to work together to fight against it. It's called MERS. I heard people talking about it a lot. Some people said, oh, MERS, it's just a cold. Then others asked, if it's just a cold, how come it killed people so badly? We can see there are some misleading concepts that confuse us. That's why today I want to share the information with you, let you know how to protect yourself from it. Now you probably have these question marks in your mind. What is MERS? What are the symptoms? What is the cause? How does it transmit? And how to prevent from it? Let's go through all these questions together and we will find the answers. First, what is MERS? It's an abbreviation for Middle East Respiratory Syndrome. It was named because of its origin when it first occurred in 2012 at the Middle East area. This person died after 11 days since he has had a fever and cough, then was diagnosed as the first MERS patient in the world. From the name, we can see it mainly affects people's respiratory system, causing cough, fever, and other flu-like symptoms. That's why people said it's a cold. Then this brings us the second question. What are the exact symptoms of this disease? Well, the symptoms range from mild to severe, depending on the level of infection and the individual health conditions. According to the clinical reports, the common signs are fatigue, sore throat, cough, and fever. If the infection is out of control or the person has other medical problems, it probably leads to shortness of breath associated with some gastrointestinal symptoms such as vomiting and diarrhea. There were rare cases yet have been reported that the patients who get infected by MERS could develop pneumonia or kidney failure, which are the common reasons that cause death. After knowing what it looks like, you may want to know what is the reason that caused this disease happen all of a sudden. Well, the virus is called MERS coronavirus. It's a newly identified virus which belongs to the genus Beta coronavirus. It's different from a flu virus or the SARS virus. It's a species with a single-stranded RNA. Some of you maybe know that the RNA virus is different. Their replication and the variation rates are way faster than the DNR virus. That's why it's hard to control. After so many lab researches and clinical tests, so far the strains have been found in camels, bats, and human beings only. That means these three groups have high risk to carry and transfer the virus. Before we go to the next question, I want you to look at this graph. It shows the rate of world MERS outbreak. The blue line is the numbers of infections, while the orange line indicates the numbers of deaths from MERS. It's clear to see both of these data have been increasing since 2013. From this graph, we can also see that there were two jumps of infection. One happened in Saudi Arabia around 2014. The other one happened in South Korea just several months ago. The spreading speed is so fast that more and more countries have had reports, such as Korea, United Kingdom, China, and so on. Then how does it transmit? Well, it's not fully confirmed yet, but upon the recent experiments done by the medical centers in the United States and in the Saudi Arabia, this disease can be transmitted by direct contact with camel's milk and camel's meat. And the report of infection among the family members and the caregivers from the United Kingdom indicated that this disease can also be transmitted by direct contact with infected persons. So it can be transmitted between human beings. In addition, it's also suggested by scientists that this disease can also be transmitted by air through coughing and sputum. This can also explain its spread all over different countries. There's a common saying in China: the best cure from a disease is not getting one. It sounds very funny, but it's true. Since currently there's no effective vaccines or medicines coming out yet, prevention is always the better way to protect us from it. Now, how to? There are three main important things to do. First, keep personal hygiene. The second one is contact prevention. The third one is contact precaution. Talking about personal hygiene, hand washing is always the top one important thing to do, because hand washing can kill more than half of germs on our hands, therefore can prevent so many diseases. Stated by the Centers for Disease Control and Prevention, hand washing can reduce the risk of respiratory infections by 16%. I'm sure you notice the signs of hand washing at all of the public places, because it's really important. The next one is contact prevention. That means avoid contacting the pathogens. Try not to go to those suspected areas like the farms. If you have to, disinfect yourself, including your clothes and the other items before and after going. The last one is contact precaution. If you have to visit the suspected patients, remember to put on the protective items, includes masks and guns to protect yourself. And remember, we are all responsible to report those suspected cases to the relevant departments, such as the CDC in the United States. And also, you should understand the isolation of these suspected or infected patients should be at least 24 hours after the resolution of the symptoms. Now, I think all of you have a more clear picture about this disease after you understand what it is, what it looks like, what can cause it or transmit it, and more importantly, how we can protect ourselves from it. Share this information with your families and your friends so they won't go panic whenever they heard about it, but also take this serious rather than considering it as just a cold. Well, I wish you all have a healthy and happy life. Thank you very much.
Thank you.